Good morning or afternoon, depending on when you are watching this video. In today's video, we're going to go over Activity 28, heart problems. Let's read up the top here. It says the tissues of your body need a constant supply of oxygen. And then it says, remember the circulation model from Activity 18. We didn't do that, so we're just going to kind of skip over that. Imagine what would happen if the flow of blood had stopped. The body would not get the oxygen it needs. The body's tissues can survive for only about 4 minutes without a fresh supply of oxygen. Two organs that are especially sensitive to a shortage of oxygen are the brain and the heart itself. Challenge question: what causes a heart attack or stroke? Reading. The heart needs blood too. Blood goes through your heart as it is pumped, but the blood passing through the chambers of your heart does not supply oxygen to your heart muscle. Some of the blood that leaves your left ventricle travels back to your heart through arteries known as coronary arteries. The coronary arteries lead to a network of capillaries in your heart muscle. These capillaries carry the blood that provides oxygen to your heart muscle. If the blood supply is blocked or reduced, heart muscle can be damaged and pain results. This is commonly known as a heart attack. If a large enough part of the heart muscle is affected, then the heart can no longer pump blood. Heart failure and death can result. Okay, activity 28, heart problems here. You can see a diagram of the heart here again, and here is, I guess this is like a actual picture of your heart, and you can see the coronary arteries that feed the heart muscle blood-rich or oxygen-rich blood. Here's another good diagram that shows how blood enters and exits the heart. So stop think question number 1A. Look at stop to think question number 1 on student sheet 21.1, problems in the heart. Think about what would happen if the blood flow were blocked at point A on the diagram. On student sheet 28.1, shade the area of the heart muscle that would be affected. B. Think about what would happen if the blood flow were blocked at point B on the diagram. On student sheet 28.1, shade the area of the heart muscle that would be affected. C. Which heart attack would be the most likely to kill a person? The one caused by a blockage at point A or the one caused by a blockage at point B? Explain. Okay, so you can pause the video and do that now. Okay, back to it. How heart attacks happen. Arteries supplying blood to the heart can become blocked by blood clots or by fat deposits. Look at the normal and blocked arteries on the next page. And one condition called arteriosclerosis, wow, a mouthful, deposits of fat partially block the center of the arteries. A diet high in some kinds of fats is associated with a high risk of this condition. People who have high levels of fat, called cholesterol, in their blood may modify their diet to reduce their cholesterol level. So you see normal, and then you see an example of blocked arteries. So look at stop to think question 2 on student sheet 28.1. In artery A, draw a fat deposit that would block the artery just a little. In artery B, draw a fat deposit that would block over half the blood flowing through the artery. Which of these two arteries, A or B, would more likely to become completely blocked if a small blood clot came through the artery? Why are people who are recovering from heart attacks sometimes given medicines to reduce the clotting activity of their blood? All right, so you can pause the video and do that now. All right, back to it. Medical help for blocked arteries. There are two common treatments for blocked arteries in the heart. In one treatment, called coronary bypass, the surgeon inserts a segment of a vein removed from another part of the body around the blocked artery. This helps the blood flow through another pathway, bypassing the blocked artery. In another treatment, called angioplasty, the surgeon inserts a tube with a balloon-like device into the partially blocked artery. The balloon is then inflated to stretch the artery. After the balloon is deflated and removed, the artery will open more than before. Often, the artery is opened by angioplasties. Doctors insert a tiny tool called a stent. This is like a small piece of a straw that holds the artery open so it will not close up again. Unfortunately, stents do not work for everyone. Sometimes a stent will collapse, resulting in another blocked artery. Occasionally, additional blockage will build up around a stent. To help prevent this, some stents are coated with medication to prevent the additional blockage. Currently, scientists are developing new tools and doctors are experimenting with new techniques for keeping arteries open. Stop to think question number 3. Look at Stop to Think question 3 on student sheet 28.1. Imagine that tests reveal that a person has a blockage developing in the artery at point X on figure 4 and 5. Doctors are planning to do a coronary bypass operation. Does figure 4 or figure 5 show a bypass that will help this person's problem? High blood pressure and heart disease. As the strongest muscle in your body, your heart first pumps blood through your arteries. This pumping action creates pressure within your blood vessels. As you discovered in Activity 27, which we didn't do, the pressure's on. High blood pressure forces the heart to work harder to pump blood through the circulatory system. This can cause the heart muscles to become enlarged and weakened. It also strains the arteries, causing them to lose their ability to stretch. They become harder and less elastic. This is known as hardening of the arteries. This process occurs with age, but is more common in people with high blood pressure. With damaged arteries, blood clots or deposits of fat are more likely to form. When the arteries that supply the heart are damaged, a heart attack can follow. A similar type of heart attack, known as a stroke, known as a stroke, can happen if the arteries to the brain are damaged. In most cases, researchers do not know exactly what causes high blood pressure. Several factors, though, seem to increase a person's chance of having high blood pressure. Factors that increase the chance of an illness are called risk factors. Risk factors for high blood pressure include the person's age, weight, race, gender, and body type, whether the person smokes cigarettes or how much alcohol the person drinks, the person's diet and how much frequency of exercise, and heredity, whether the person's parents or grandparents have high blood pressure. Older people with a family history of high blood pressure, people of African descent, and men generally have a higher risk of high blood pressure and other types of heart disease than other groups. Being extremely overweight, living an inactive lifestyle, drinking large amounts of alcohol, and in some people, eating a diet high in salt are associated with a greater risk of high blood pressure. Smoking heart disease. Cigarette smoking can increase the risk of death from heart disease because of its impact on several risk factors. Smoking can increase blood pressure, can increase the formation of fat deposits in the arteries, and increase the chance of blood clot formation in the arteries. A smoker is less likely to survive a heart attack. Smokers' lungs are not as efficient as absorbing oxygen from the air and thus provided less oxygen to maintain the heart. Okay, you have analysis questions 1 and 2 to do in your notebook. Thanks for listening, boys and girls. Have a wonderful rest of your day.